welcome to the Mastermind channel. If you are interested in psychology themes and if you haven't subscribed to this channel yet, subscribe and activate the bell so you'll get notified every time I post a new video. The last video, we found that anxiety has similar symptoms to fear, and that fear is extremely important for survival and adaptation to the environment. But we also found that some people react maladaptively to some situations that for most people are common, and sometimes they are even fun. Early diagnosis of anxiety and to find the effective therapy is extremely important, because there are different types of anxiety. The main ones is generally anxiety disorder, social phobia, specific phobias, agoraphobia, and panic disorder. Today, we're going to talk about generalized anxiety disorder. This type of disorder is highly prevalent in developed countries and has a higher incidence in the female sex. Anxiety persists for a long period of time, for at least 6 months. And in adults, they tend to have a consistent preoccupation, a concern about everyday issues. In children, they tend to be overly concerned about school performance. There are also other symptoms that can help to identify this type of anxiety. In adults, there are at least 3 of those that I'm going to talk about. Irritability, inner tension, nervousness or agitation, muscle tension, sleep disorders, lack of concentration or an empty mind, and easy fatigue. So there are many risk factors also that can help to develop this type of anxiety. For instance, an ambience that is very stressful, like a family stressful environment, or a stressful environment at work with too much activity, can be one of the risk factors. Also, to have a chronic disease or a serious illness, because the person is concerned about the treatment, about the finances, the financial situation, or about the future. And also genetics can have an impact. And the excessive use of alcohol, drugs, or even nicotine or caffeine also. In children and in childhood, the fact that they are exposed to traumatic events or abuse also can make them develop this type of anxiety later on. In the pandemic situation that we are experiencing, there are many risk factors. For instance, the isolation or the financial issues, the financial concern, or about the job, unemployment, and also family issues, having to deal with disease and the loss of the dear ones. So we have to be aware of that as well. There is therapy that can help to cure anxiety. For instance, cognitive behavior therapy. It helps you to understand your behaviors, and it helps you to deal with your anxieties and your fears. Sometimes medication can be also needed But for that, you should seek for a doctor to prescribe the medication that is necessary. There are also measures that you can do alongside therapy at home, and they are essential measures and they can help the therapy. So, for instance, you can try to identify the thoughts that can cause anxiety and fears and try to change them for thoughts that are more adaptive, more positive, in order that a small concern won't become a huge problem. Also, you can be more organized. That helps a lot. Um, Try to manage stress and relax. Take breathing exercises, for instance, every time you start to feel more anxious. Also, it's important to have time to relax, like with pleasure activities, and to have your fun moments. Spend time with your beloved ones as well. It's highly important. And dedicate time for yourself, for your self-care. And this is very important as well. Also, obviously, avoid caffeine and drugs. And very important to maintain your focus in the present and try not to think about the future so much. So finally, take care of yourself, take care of your thoughts, and smile more often. It's very, very good to smile. So we're done for today. I hope you liked the video. If you liked it, leave your like and share this video with your contacts. In the next week, we're going to continue to talk about the different types of anxiety. So until the next week.